What's up, guys? Josh Mason from the Detox Dudes here, about to get Procaine injected into my back and tonsils.
Today we're going to be doing some prolotherapy injections to your SI joint with the dextrose solution, and probably a little bit of neural therapy for your tonsils.
What is Prolo injections? What is that?
Yeah, it's a mixture of procaine, dextrose, and usually B vitamins, sometimes some other nutrients. And it's aimed at helping stimulate new fibroblast production and collagen synthesis in soft tissue, connective tissue, ligaments, tendons, cartilage, so forth.
And from my understanding, it inflames the area, and then the immune system comes and works harder in that area.
Exactly. Yeah, it's the dextrose that acts as the irritant, kind of like stimulating a local inflammatory reaction, which kind of triggers the immune system to kick in. In a sense, it's kind of like a pseudo mimicking of like re-injuring the area to bring the necessary attention to that area, and it's the dextrose that helps initiate that. With other regenerative medicine techniques like PRP, you're actually using the platelets from your own blood, which have the growth factors and cytokines in them themselves, that would stimulate the same healing modality to the soft tissue.
But we're using sugar as the main irritant for an injury, so essentially putting dextrose. What is dextrose exactly?
Yeah, it's sugar water. Yeah, so we use it in a lot of ways in medicine. You can get IV bags of it it's kind of a substitute for normal saline, 5% dextrose, so we call it D5W. And it's given intravenously. You can give it as an emergency injection for someone who goes into diabetic shock to get them to bounce back. So yeah, that's.
It's just fascinating that you're introducing this into a joint. The joint kind of likes it, but kind of doesn't like it. So it kind of acts like a poison almost, which forces the immune system to go to it.
Yeah, you can think of it as that. But we're talking small doses here, and it's diluted and mixed with we use 1%, 1 to 2% procaine, and then the B vitamins. They used to use other irritants like phenol back in the early days of prolotherapy. Hackett Hemwall, doctors who were like the founders of prolotherapy, they used phenol. Other doctors have used glycerin, which is kind of like a substitute for dextrose. Splenda, just kidding.
Monk fruit.
Yeah, right. A little pinch of B12. It's like a little pink cocktail. And the first thing we're going to do is mark off your anatomy.
Should I make it lower?
Maybe loosen your button there.
I know the pain is like here, but is that where the SI is? Right?
The pain's way out here?
The pain is like here. Is that SI?
Yeah. We're right here.
Oof,
right there. Yeah.
Sore,
Yeah, that's here. If you're having pain out here, that's probably like the glute muscles and maybe like piriformis and obturator that are trying to compensate, and they're just kind of overworked and trying to protect that area. All right, so we're going to mark off your anatomy first. Find the L5S. I don't know if the camera can see it here, but it's the only ligament that connects the last two lumbar vertebrae to the pelvis, the iliac crest, as it's coming across. So L4 and L5 off the TVPs have a short little ligament that connects right here and right here. Is it tender on the left too?
No,
only on the right. Yeah. We'll do it bilaterally so it's symmetrical. and balance. We always do that in the spine and the SI. Anyway, that's a pivotal point for not only SI pain, but low back pain too. So we'll inject that guy too. And then we'll just come down here and pepper both sides of the SI. A little betadine to clean you up. Okay. All right. Right there. Was that spot?
That's pretty. It's relatively. Yeah, there it is. You just hit
Right
it.
there. Okay. Here we go. First one. Breathe.
Ooh, ah. 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 Oh, why is it so painful?
It needs it. That's why. It needs it. That's why.
Really?
Yeah.
When it's tight, it's more painful. Ah.
Well, if it's not necessarily tight, if it's loose or damaged or become degenerated or just been out of alignment for a long period of time. It's like a rubber band over, a period of time. It's going to lose its integrity. Okay, where was that spot? Right in there?
I think I'm like, yeah, that was sensitive, but I'm a little desensitized
After that last one?
Yeah.
Okay, here we go. Hitting the right sided side ligaments. Okay, relax. Doing okay?
Yeah.
How about here? Not so much?
No.
Okay.
A little bit there. I feel like lying to you though, so you don't inject it.
I'm on your team.
I know, fuck you though. Oh my god.
Hate the game, not the player.
Oh.
4 more.
4 more total?
4 more total.
Okay.
You got this.
Left side's way easier.
Yeah.
That means my right side is just
Jacked.
up. Yeah. I need to. What do you think about like lacrosse ball on those areas?
Yeah.
But not the next few days, right?
I would, do lacrosse ball out here on the glutes and piriformis.
Okay.
Because
they've
they've been having to compensate and pick up the slack. Last one. Well done. Okay, hang tight.
Hey guys, what's happening? It's now 2 weeks after that Prolotherapy injection, and as expected, I had about 5 or 7 days of amazing relief. I was so grateful for those 5 or 7 days. It makes me know I'm on the right track. But Prolotherapy on such a severe and chronic long-term injury such as my sacroiliac joint is not going to happen in one shot. I have to get consistent treatments every 3 weeks for the next few months. So I have high hopes for it. I only had done it once before, over a year ago, and this was done when I was all messed up in a my musculature was all messed up and tight. There's no prolotherapy, no injections in the world that could have helped me because it was my musculature that was pulling my joints out of place. Now my musculature is much healthier and better and balanced, and now I kind of have this residual ligament damage that I'm trying to heal. So again, this isn't a quick fix, but if you have ligament damage or joint pain, consider prolotherapy. Check out Dr. Josh Donaldson in Los Gatos. There's also plenty of other practitioners in the country who do it. As long as they're well trained, it's pretty straightforward and safe. Again, it's just sugar and B vitamins. So I'll make an update at some point in the near future when I really get to the end of this back injury. I have high hopes that in the next 3 to 5 months I have a lot of treatments lined up and experiments, and you know, I'm a human guinea pig at this point with my back, so I will land on the gold and I will find that winning formula for my back. I'm already 70% of the way there compared to a year and a half ago when I could hardly even walk. So stay tuned, make sure you hit that subscribe button, leave a comment below if you've done this or if you have any other ideas for sacroiliac joint pain, and I will see you in the next video.